What's up, guys? So I'm back in the United States. I'm back doing medical student things here, and right now I'm taking this course, Transition to Residency, Transition to Internal Medicine Residency. And anyways, I got done a little bit early today. It's 4:30, and as I was driving home, I just thought it's kind of early. I don't really want to go home. The thing about fourth year is like we get bored now, right? So it's like, what am I gonna do at home? So I came to this lake a few miles away from my house. It's a nice area. I come here sometimes to think, just kind of enjoy nature, because the thing about life in America, there's a lot of good things about living here, but one of the negatives is, for the most part, you're not as connected with nature. You don't walk as much. Most of the cities just have a lot of concrete in them, and so it's nice to come out to places like this sometimes. But anyways, the reason I made this video is for a couple of reasons. First is to give an update on my last video. I was talking about thyroid cancer and how I was recently diagnosed with that. So I want to give an update on where I'm at with that. And the second thing is match day. So, this channel is called Step 2 and Beyond, right? And now we're at the and beyond part. In fact, I matched recently. So I'm going to talk about that as well. So first, let's talk about the thyroid cancer. So I was diagnosed with papillary thyroid cancer back in January. And then I spent 2 months in Turkey on an international rotation I had planned before. I came back a little bit early. I came back a couple weeks early from that. And the reason for that is because I was worried about this mass, right? I was worried that maybe it's getting bigger. Some people had told me that my voice was different. And so, I wanted to come back to the United States before I got like metastatic cancer or something bad. Even though I knew and I had heard that this type of cancer, papillary thyroid cancer, doesn't grow, right? I mean, it grows, but very, very slowly. So anyways, I came back to the United States of America, to where I live, and we did an ultrasound. Was the first thing we did. And the ultrasound, I just, I'm sleeping on the table, and I asked the ultrasound technician, I'm like, does it look any different than before? And she said, no, it's pretty much the same size, right? These things grow pretty slowly. And that, that made me happy. But then she said, I'm also going to look at your lymph nodes because they didn't look at those last time. So she looked at all my lymph nodes all the way up to level 2, to the ones under my chin. And for one of the lymph nodes, there was some calcifications in it. So that was interesting, one of the lymph nodes. So later, she didn't really tell me that. There was just something in my ultrasound finding. She said I'd have to wait for the radiologist to talk about it. She's doing her job. She doesn't want to give, her preliminary thoughts. But anyways, then the radiologist wrote his report, right, and said, you should probably biopsy this. And then I had a clinic appointment, like a couple days or maybe a day after that ultrasound. And in the clinic appointment, I talked with my surgeon, endocrine surgeon, and she said, listen, I mean, first I told her what I thought. First I talked to the resident who told her what I thought. And I said, I understand, I have this cancer, on the left side of my thyroid. And it's pretty big, but ideally, I just want half of my thyroid out. Because I don't like the thought, I don't like the feeling of knowing that, I'm going to have to be dependent on this medication for the rest of my life. I mean, don't get me wrong, if they take out half the thyroid, I might still have to take this medication, but this idea that I'm going to be 100% dependent on this medication, that my body cannot survive without it, it was still something that I was grappling with at the time, and I still am now, just not to the same extent. At this youngish age, at 27 now, to be dependent on a medication, despite seemingly doing everything right in your life. But anyways, so that's what I told them. And I said, I understand that there's a higher risk of the cancer coming back because the nodule is so big, but I'm willing to take that risk. I'll do ultrasounds. I'm in healthcare. I'll look at it. I'll have people look at it. And I'll take it out later, take the other side out later if I need to. But my surgeon said, look, this is a pretty big nodule, and the guidelines are pretty clear that above 4 centimeters, and mine is like 6 centimeters, you need to get the whole thyroid taken out. And not only that, but you have this lymph node, which looks weird. If that lymph node is positive, then that indicates some kind of metastatic disease. That indicates that the cancer has left the thyroid and gone to lymph nodes, maybe even microscopically gone to other places as well, travel through the lymph stream. And if that's the case, then you need radioactive iodine therapy. And radioactive iodine therapy is basically the element iodine. You take a version of that which is radioactive. And the only part of the body which uptakes iodine is thyroid tissue, right? Because the thyroid uses iodine to make thyroid hormone. And so this therapy, it basically kills all thyroid tissue, which is a good thing if you have thyroid cancer, because it's gonna, even after the surgery is over, it's gonna go in there and make sure everything microscopically is dead, right? It's a good therapy. But the thing is, if you have half your thyroid in there, then there's no point in having that therapy, right? Because that therapy is going to kill the other half of the thyroid. So that's what she told me. So she said, let's have a CT scan. Let's look at this lymph node, and then we'll talk again later. So I had a CT scan, and the reason she wanted the CT scan was, right, because if it's in this lymph node right underneath my neck, right underneath my chin, this level 2 lymph node, then there's a pretty high chance that, it's in other places of the body, like the lungs. So we had a CT scan, and, I went and had it, and I had some contrast too. And then basically right after I had the scan, the scan was available on Epic, on the electronic medical record. And because I work in the hospital, I can look at this electronic medical record. And so I scanned through the images, having just taken radiology, and I was like, I don't see anything grossly bad, but I see some stuff in my lungs, which I think was just like the bronchioles, but I'm not that used to looking at lung CTs, even though I took a very small radiology course. And so I was like, man, I hope this isn't bad. I don't know. It just made me more nervous. But luckily they told me that the radiologist will take like 2 or 3 business days to read it, but luckily the radiologist read it like a couple hours later, which I guess is a nice thing about more and more I've come to appreciate. I've been in this university town for like 8 years now, and I've slowly gotten bored of it, right? Like, what am I doing here? But lately with these health issues, I've really come to appreciate being in a place like this with a healthcare system like this one. Not a healthcare system, but the hospital, right? A big hospital. But anyways, the scan came back a few hours later, and it said there's no evidence of gross lymph node involvement. There's no evidence of metastatic cancer to the lungs, and then the lymph nodes are bilaterally enlarged on both sides, and we don't really know why those are enlarged with the CT scan. So next thing, a few days later, I had this biopsy, fine needle aspiration biopsy. I had one before of the actual thyroid, which came back as papillary thyroid cancer. But this time I had it for the, for that lymph node. And even the radiologists, they're looking at it, they're saying, man, this looks like cancer. Like, there's calcifications in it. It looks like your thyroid tissue. They didn't outright use those words, but that's kind of from the way they were talking, that's kind of what they were thinking. And also just the way they were talking to me, it's very sympathetic, right? Because I'm one of their colleagues, and this is the situation that I'm in. But anyways, thank God, alhamdulillah, the results came back, and it said that it's probably reactive. It's probably some sort of infection or some sort of inflammation which caused that lymph node to look weird like that. So where I'm at right now is there's no evidence of metastasis from this giant mass on my neck. So alhamdulillah, thank God. So I went back and talked to the surgeon again, and I said, and she said, listen, this is still very big for a thyroid mass. You should still have a total thyroidectomy, in her opinion, because there's a high chance it comes back, right? And not only, and I'm being this detailed in case anybody else watches this video in the future who has this issue, who's maybe not in medicine. You know, if it does come back, the thyroid cancer, after they take out half of the thyroid, there is a chance, you know, if I'm neglectful with my screenings and things like that, that I won't notice it until it had left the thyroid, until the papillary thyroid cancer was in my bones or in my lungs. And the thing about cancer in your bones, you guys might have read, when there's cancer in your bones, you don't just, there's no symptoms until one day you're holding like a grocery bag and all of a sudden your humerus snaps. You know, and by that point, it's so late that you're basically chasing after the cancer instead of going directly towards it. So anyways, there is that. But my thing is, I'm in healthcare. I'm okay with doing an ultrasound regularly. So just take out the half for now. But she did say there's some lymph nodes underneath the thyroid, central neck lymph nodes. And we didn't really get a good look at those with the ultrasound, right? Because those are deeper than the thyroid. The ultrasound doesn't go that deep. So during the surgery, after she takes out the left side of my thyroid, she's going to look at those lymph nodes grossly. And if she notices that those look like cancer, if there's gross involvement of papillary thyroid cancer, then she'll take out the other side too. And I said that's fine, you know, because if the cancer is in the lymph nodes, no matter how much, there is a chance that it traveled through the, I mean, if the cancer is in the lymph node, that means it's taken, you know, I don't know if you guys have taken like a cancer biology course, but once the cancer has left the place where it was before, that means the cells have mutated to an extent where like they can like go from being in a static place, like inside of an organ, to like moving and going into like the bloodstream and stuff, right? I forgot the name. I think it's like epithelial to mesenchymal transition. That is not a good thing. Because if it's in the lymph nodes already, it could be somewhere else. So, you know, I said, look, you know, if you find it in the lymph nodes, in those lymph nodes, the central neck lymph nodes, after you take out the left side of the thyroid, that's okay. You know, then take out the whole thing, and then I'll have that radioactive iodine therapy. So anyways, that's where I stand now. I'll get that surgery later this week. I doubt I'll make like a video right after the surgery. I'll probably make an update video sometime after the surgery, though, to talk about how the surgery went and to talk about my recovery. God willing, inshallah, everything will go well. And you know, I talked about this a little bit in my last video, but I'll say it again. There is no best form of cancer. Nobody wants cancer. This sucks. But look, there's people who have it way worse than I do. There's people who have, you know, way worse conditions than I do. And, you know, I can't whine and say, oh, I'm 27 years old or whatever. You know, I exercise. There's people who have all sorts of bad things happen to them for all sorts of reasons, who are good people, right? So, you know, always, you know, my thing is, you know, this is all the will of God. You thank God, you know, we all get tested in this life, and one day, hopefully not soon at all, but one day, we're all going to leave this life, you know, and inshallah, God willing, go to the next one. So, yeah, it's something, you know, I can accept this. You know, I've accepted this, and it could have been a lot worse. And once I get this half of the thyroid out, God willing, that'll be the end of it, right? So, I don't see myself as a victim. I don't spend too much time feeling bad for myself. But you know, it sucks, and I make these videos so people in the future who are worried about their situation can hopefully watch this and feel better as well. Okay. That's my thyroid cancer. Now let's go back to the medical school part of things. Match day. So, going back, the last medical school related video I made was my step 2 score reaction, right? And that was, I got a 235 on step 2 after studying for so long. And I was grateful at the time because my practice scores were like the highest one was maybe like, I think maybe 207, maybe a little bit higher than that. And so I was like, if I pass, no, I must have at least, I think I got at least like 220 or something on a practice test. But anyways, I don't really remember. But, I was like, if I pass this exam, I get like 215 because the passing is 214, I'll be happy. I'll be some kind of doctor. And I got 235. And in retrospect, I'm still kind of pissed off about the score. I'm still kind of, disappointed in myself because I'm like, man, I've, been in medical school. I should have done better. I should have done better than 235. The average for IM residencies, for internal medicine residencies, which is what I'm interested in, is like a 250, 255. But anyways, I passed the test. And the reason I applied internal medicine is because I love, variety. In my last video, I was in Turkey. I like variety in my life. I like traveling places. I like variety in medicine. I never fell in love with any part of medicine. I disliked everything a little bit, including internal medicine, and I liked everything a little bit. But after step 2, after the constant grind of studying and doing some internal medicine rotations after step 2, I've really come to appreciate internal medicine, just the depth of knowledge that you attain through all this, wide variety of illnesses. And I also like that if one day I don't like internal medicine, if one day I don't like primary care, I can do some kind of fellowship. And, to be honest, I've been low-key interested in gastroenterology and GI for quite some time, and because my mentor is a gastroenterologist. And, yeah, so going into applications, I was like, I want a place where, I like global health, so that was one thing which I thought about. I wanted a place with good global health opportunities. I wanted an academic institution where I knew that if I wanted to do fellowship after residency, I could. But at the same time, I applied to some community programs too, because one of my favorite parts of medical school was actually not internal medicine, but family medicine. I went to this very small town in the middle of nowhere and practiced medicine there. Worked with a family medicine doctor, worked with primary care issues, and I really enjoyed it. I enjoyed everything about just being in that small town, being in a community atmosphere. I liked how the patients seemed to appreciate us more there. They would bring like cookies and stuff, it's good stuff. And I like that because there wasn't a lot of doctors there. The community in general, people in the hospital, everybody seemed to appreciate us there. So I like that about being in a small town. I liked a lot of things about being in a small town. I like nature, right? So that's why I applied to some community programs, but overall, I wanted to get into an academic program. That was my goal. So after that, so I wrote my personal statement, and in my personal statement, I basically wrote, the gist of it was, look, I used to be a scientist before medical school. I got a master's degree in biology. And the reason I went to medical school is because I like connecting with human beings. I felt like, I specifically started my personal statement with an anecdote of me being in the lab late at night, as a master's student, or even late in undergrad, and having another field experiment, having a pipette in my hand, having a picture of a gel in my hand, and just thinking, what the hell am I doing right now, man? Like I thought I would be like, I was a 19-year-old naive undergraduate student when I started working in the lab, and I thought I would be like I thought I had the potential to be like, do great things, right? And I do, but it's very, very hard in science to do great things these days. Science is not what it used to be 50 years ago, and really I found myself studying this one thing, which it got to the point where even my PI, my mentor, wasn't interested in the thing I was researching, but I was, and so it was more selfish than anything else. So, I was like, this isn't the path for me. I'm going to go into medicine. Now, that's how I framed my paper. To be honest, I've always kind of wanted to go into medicine. That's why I even went into research. But I did consider becoming a scientist, or at least an MD PhD once, at that point in my life. And so I stretched the truth a little bit. But anyways, so from there, I basically talked about how I wanted a human connection. I wanted an immediate impact of my work. I wanted the things that I learned to, really, I wanted to see the fruit of the things that I learned, faster than however long it takes for a scientist to see that fruit, if at all. And so I went into medical school, and in medical school, I found that internal medicine was a specialty where I get that intellectual stimulation, and also the personal connection. And, the intellectual stimulation is something which, in the first 2 years of medical school, even leading up to step 2, I was like, I don't give a shit. I was so busy, right? I didn't have the same curiosity, but I do now. Now I've come to really appreciate the complexity of internal medicine. The just everything, about it is cool, where all these algorithms come from, Chad's Vask or, Ascites, or just, all this wideness of it, and all the research and all the work that's gone into making internal medicine what it is, and the potential to, expand on that if I want to. So I talked about, internal medicine. I talked about how I wanted to connect with people, and also how I wanted to be intellectually stimulated, and also how I liked variety in my life. And so internal medicine was really the specialty for me. And also, the potential to do fellowships. I touched on that a little bit in my personal statement. And then I got interviews, and I got 12 interviews, 13 total, because for one program I interviewed for both the primary care track and the categorical track. And the interviews, I felt, went well. Now, I didn't prepare that much for my interviews. Okay, I didn't memorize any answers, none of that stuff, but I had good conversations. I felt like I was honest. Felt like I connected well with everybody interviewing me. So I had my interviews, and then couple weeks ago, 1 week ago, was match day. And I opened my envelope, and on Monday, so there's this statistic that if you have at least 5 interviews in internal medicine, you're guaranteed to match. And on match week, on Monday, you get an envelope which says whether or not you matched, and then on Friday, you actually find out where you matched. So on Monday, I found out I matched, and I was like, yeah, okay, expected. And then, I expected to match at like these top 3, institutions, the top 3 places that I had ranked. And since I didn't match any of those, I'll tell you guys which ones those were. It was Utah, West Virginia, and Vermont. And then there's a new program in Kansas City too. I had ranked at like 4. So, I expected to match on one of those, right? But I opened my envelope, on match day, and it said I had matched in this community program in the middle of nowhere, which I had ranked number 12. Now, I had ranked this program for a reason. It's a cool program, and you get really cool training there. But man, it was 12th on my list. I didn't expect to match there, and there are reasons which I didn't rank it much higher, because going into fellowship from there is going to be a lot harder. And so I have been thinking about, why did I not match higher? Why did I match 12th on my list? And I guess the 2 things are step 2, and then my MSPE. I forget what it stands for, like Medical Student Performance Evaluation, I think. There's this, so I got 3 letters of recommendation, 1 from an ICU doctor, 2 from hospitalists, and I connected well with all of them. And the 4th letter is a standardized letter the school gives, which kind of says all of your grades and stuff, all your grades and evaluations and stuff. And my average for most evals and clinical rotations was like 80 to 90%. But the average for like the school was like 95%. And you can see that like as a box and whisker plot on this letter. And so you can see my dot like outside of that box and whisker plot. And it's not like I freaking like didn't connect well or I was a jerk or anything. It's just I made the mistake of asking too many people for evaluations. I didn't play the game the way it should have been played, which is to, kiss somebody's ass, one person's ass, 2 people's asses, and ask those people for evals. It's just not my personality. I just can't do that kind of shit. I'm the first medical student in my family, so nobody had ever told me to do this kind of shit either. So for most, rotations, I asked for like 5 evals, and I didn't even think too much about it. I was like, because I didn't know how big of an impact it would have on residency. And I got decent evals, 80 to 90 was my like average. But I didn't get a bunch of hundreds, which is what I guess what I should have done, right? I should have found 2 people in each rotation, kissed their ass, and got in 100. And there's actually a study, reported. You can find it online. There's like a study that like female medical students get better evaluations. So, anyways, evaluation system is really stupid, but I think that's also that and my low steps to score 2 things, which probably impacted me negatively in my match. But regardless, look, I'm going to a place with good nature, and I'm going to a program where for lots and lots of miles, there's no other big hospital. So it's tertiary care center. I'm going to be seeing a lot of stuff. There's no ICU fellows there, so I'll be doing all the ICU stuff. There's no fellows in general over there. I mean, there's psychiatry fellows, but no other fellows. So I'll have the opportunity to do a lot of stuff, and I'll have the opportunity to connect with a lot of specialist attendings. So if God willing, inshallah, and if I will, that I want to do a fellowship, I think I will be able to do that. I'll just have to get close with somebody. I think the video just cut off. But so yeah. So overall, am I happy about my match? My first reaction was disappointed, but it is what it is. I'm going to be a doctor of internal medicine. I'm going to be a doctor overall, and yeah, it's going to be fine. And then after 3 years, if I want to go somewhere else, I can go somewhere else. So yeah, that's kind of my update on my thyroid cancer and on match day. So yeah, look, if you guys have any questions about anything, of course you guys can ask in the comments. And I guess I'll just show you guys why I like coming here. There's a bunch of rocks here, and so it's a good stress reliever, right? To just do that. So, all right, you guys have a good one, and thanks.